So what I'm going to do is turn it over to Mary Nielsen so she can tell you a little bit about the whys and how we ended up where we are today. And she has great information to share with you that I think is going to make you feel really good about why we did this.
Okay, you know, the very first thing that I want to acknowledge, you guys, is that change is hard, okay? We so get how change is hard. And somebody always has to be the person that falls within the category of the time of change. And it's hard on faculty. It's been hard across the state. When we started this a year ago, last January, I went away and flew off to Africa for 6 weeks to do a medical mission, coming back thinking, you know what? They're going to have all the work done by the time I get back. I'm going to be gone for 6 weeks. They haven't moved. They were still going back and forth about what's important, what's not important. Change is hard. We've been doing this curriculum since 2006. And so I get it. And in 2006, I was a faculty person when this change went through. And it was hard because we had to redo everything that we had already done. So we get that. So we really, really want to help you through the change. And bigger than that, we also want to help you understand why this change had to happen, okay? Because that's the biggest piece. We're here to serve students, but who do we serve first? Patients. Good answer. Yeah, we serve patients first. And our curriculum statewide was not serving our patients as well as it could, and it was not serving the employers of Montana as well as it could. So let me explain to you why. So here is the why. Supply. We were not supplying LPNs to the state of Montana. In 2014 and 2015, across the state, we graduated 147 students. But oh, this slide didn't get, okay. But what was happening was that between 95 and 98% of those students was moving right into the 1+1 ASNRN. So we were giving Montana maybe 2 to 5% of their need for LPNs. They didn't have them, and they were desperate. If you look, a lot of the biggest openings across the state of Montana are for LPNs. And so we were not supplying them with the need. The other part of that were students were saying, you know, I want to be an LPN. I really want to be an LPN. But I'm competing against people who want to be RNs, to go on for their BSN, and potentially their nurse practitioner. I can't compete with those students. And so now the separation of those two programs will better meet the needs of both students and employers. Okay, and then this is not just a shortage in Montana. We all know that nationwide, although it's a little controversy depending on what studies you read, but really overall we know that there is going to be a nursing deficit across the state. And this is actually, according to, by 2015, we're gonna have a deficit of 800 nurses in the state of Montana. And that's actually getting reported to the Board of Regents next week. The other thing that's happening across the state of Montana, here's our current nursing workforce age. And then look at your nursing faculty. We got a few years on some of these nurses. But we, within the next 10 years, are going to be losing even more nurses because they will be retiring. Back before the economy changed, we were actually starting to see this nursing shortage greater in Montana. But because when the economy fell, a lot of retired nurses went back to work or didn't retire. And now we're starting to see that population begin to retire. So we're going to be seeing changes there. Okay, so that's kind of the why and the supply. Let's look at the demand. The demand of healthcare, this is not just for Montana, but this is nationwide. We all know that we have baby boomers aging, and I'm one of them, okay? And so I want really good nurses to take care of me in the next 10 years. We are also increasing in the number of people with comorbid diseases, and what's our biggest problem right now? Obesity among who? Adolescents. And those adolescents are starting at a much younger age, and they're growing up with heart problems and diabetes and all of these comorbid disease processes. So our numbers are growing greater. The expanding size of our population, we are also facing a physician shortage, especially in Montana. There's not a whole lot of reason to want to go to some of our little small towns and be a physician. There's not a lot of incentive for that. So we are in a physician shortage. And then implementation of healthcare reform. And I'm not going to get into that, but as you guys get into your program, you're going to learn all about this. But a lot of healthcare is changing across the nation, and nursing has got to change with it, or we'll be behind, and we won't be the best nurses that we can be. So, so this all started with Montana applying for a $19 million TACT 4 grant. When we started writing for that grant, we thought it was a needle in a haystack, but we actually got awarded this, and it is to advance healthcare education in Montana, especially to rural and frontier. There is a huge population of students or potential students living in rural and frontier Montana who would desire to be a nurse, but they can't leave their communities. So we need to get nursing education to them so we can home grow our nurses in those communities. And that is a huge piece of what this grant will be doing. So what happened is that 11 colleges that offer PN, ASN, or BSN completion programs and greater than 90 employers representing healthcare across Montana came together. Now, not all 90 of them were sitting in a room together, but they've all been involved at different components of the process. They all came together to look at and help redesign to meet the needs of those communities, to meet the needs of the shortages, to work. Healthcare is changing from illness to what? Anybody know? Preventative, yes, okay. Promote health and prevention. We're moving away from that illness model of putting everybody in the hospital, but we're moving out into the community and into populations and addressing healthcare that way. And so we need to change our curriculum to meet that, because we put all of our nursing students in acute care, into the hospitals to teach them to be nurses. And then when they get out to rural Montana to become a nurse, they don't know how to function. So we're not giving them an adequate environmental stimulant to do that. Okay, we want to meet the rapidly changing healthcare needs. We want to make sure that there's a pathway for every nursing student to be able to re-enter a program if they want to advance their degree. So any LPN at any time will have a place to go back into an ASN program. It will be very different on every campus depending on the clinical sites and availability, depending on where in the process they would fall. But there will be a place for them to go. And then we need to make sure, to meet the changing healthcares of Montana, that we have a seamless academic progression to a bachelor's and hopefully higher, because nursing faculty will be retiring and we need wonderful nurses to take these wonderful people's places. Okay? So this is the revision of the programs. And really, Dixie did a great job going through these, but the actual changes that happened is that the practical nursing program was separated from that seamless to the RN program. It was decreased by 10 credits and 1 semester. To help meet the population changes of healthcare, there's been an increase in the curriculum in both gerontology and community nursing. And then, as Dixie showed, there'll be 5 programs or 5 colleges across Montana delivering the program. How that distance delivery will be done will be very independent of each campus. Some very minimal, some as much as possible will be provided online. Because we had a deliverable within the grant that nursing education would be available to 2DOT Montana, clear up on the High Lines, where there is no college within hundreds of miles of them. So that will be part of this process. So there'll be a distance delivery. Then the The associate degree nursing program, as Dixie said, it has been decreased by 1 semester and 7 credits, and it has actually increased the depth of the curriculum content to better match the scope of what an RN needs to do. You're not taking your first 2 semesters under LPN or practical nursing scope of practice, but you're starting to learn to be an RN from the very first day of class. And that's a huge advantage in being able to work and learn and participate as a nurse within your scope of practice. And then the BSN completion, when you graduate from Missoula College with your associate's degree in nursing, you successfully take your national licensure exam, you are ready to go into a BSN completion program. The curriculum will be the same. It will be delivered totally online except for 2 clinical credits which you can complete in whatever community you live in. And some of the programs are even offering the program as a part-time so that you can work full-time, make an RN salary, and go to school and complete your bachelor's degree. Okay? So that's kind of how the programs have. So let's talk about what does all this mean to you guys? Okay, that's nice, you made all these changes. Where do I sit in the process? I think that one of the biggest things is that, I know, again, change is hard, but if you can picture yourself in the fact that this change is better preparing you to be a nurse of the 20th century, that's a big plus, okay? Also, the change is that there's a 20 to 25% reduction in the time and approximately 16.6 for cost for your practical nursing education. So that's a huge decrease in the amount of money. And same for the ASN, it's about 20% in time and cost from the ASN to the bachelor's program. The 20% of an increase in the number of associate degree graduates over time. Biggest goal of this is that we will be providing Montana with more nurses, LPNs and RNs. We can't say that's going to happen. It's a goal, it's a prediction, and we'll be keeping the statistics and the data to analyze if we actually met that goal, okay? And then, for all of the nurses, you'll be able to enter the workforce 4 to 6 months earlier, either as an LPN or as an RN, making anywhere from $15,500 to $22,500 difference in the salary. And how we came up with that is that we took the annual year's salary and then divided it, and the Department of Labor helped us figure out these numbers so that we could be accurate. So you will be increasing the time that you go to work and the money that you'll be making at a quicker time, okay? So that is kind of a very, very quick analysis. But the biggest thing that I think that I would like for you to take away from here today is that we didn't make the changes to make it hard. I know it is hard, and I know that change is hard, and some of you will fall between those cracks, but we'll help you figure out how to build that bridge and to take that crack away. That's what we're here to do, both as a grant and as an awesome program of nursing here. But what we really want to do is that as Montana continues to grow, to face the upcoming changes in healthcare and the upcoming shortages of nurses, we want to make sure that we are preparing all of you to be highly trained, excellent nurses to meet the healthcare needs of all of your fellow Montanans. And that is one of the main reasons that this process went through.